Hey there, this is Dr. Doug Willen, and welcome to my Thyroid Crash Course. You're probably visiting me through my Facebook page originally, and I post a lot about thyroid because it's one of my favorite subjects to work with. Over the last 20 years, I've been in clinical practice here in New York City. I'm mostly a chiropractor, but I've also written a book on the Paleolithic diet in 2012. In addition to that, I've worked as a clinical nutritionist for 20 plus years, where I advise my clients on food, lifestyle, and how to supplement clinically to affect their body. So not just taking a multivitamin, even though I make a multivitamin that I like, but more how do you impact the function of your body through natural means, and maybe not necessarily through pharmaceuticals. And as you can see, as we go through this crash course, I'm not opposed to pharmaceuticals. So people are on Synthroid or other thyroid medication, and that's a good thing. That's probably what you need to be doing at this point in your life. But what else can you do? The other problem that happens often is someone goes on, for example, Synthroid. I'm using that as an example because it's probably the most common hypothyroidism medication that's distributed in the world. But there's also other brands that you might be on, and it would apply the same way, where often I hear someone say, yeah, that first year on the medication was fantastic. I lost weight, my hair, skin, and nails felt good, I had my energy back, I started to feel like my old self. And then those results started to slip after a year or two. So someone's been on Synthroid or levothyroxine or one of the other products for a couple of years, and now they feel like it's not as good as it used to be. So what else can they do? There's lifestyle, there's natural supplements. I make a natural thyroid supplement that I'm really proud of, and it came out of 20 years of clinical practice. So it's not like just some product I found in China and I'm selling it on the internet. No, these are ingredients that I gave to my patients and clients over the years to help them. And I also got feedback, and I got results, and I got to monitor and track them. And originally, 20 years ago, I used to just give a single product like ashwagandha or schisandra or L-tyrosine direct in one single isolated form. But I found that blending them together, which now I'm using a unique custom blend that I like, is a perfect. No, there's nothing perfect. But is it worth a try? Definitely. And I have people that take my product that are on medication, and they piggyback my natural thyroid support right on top. And I'll talk about that a little bit more into the video. But I also have people that suspect they have low thyroid. It's estimated that close to 13 million Americans have undiagnosable low thyroid, which means when they do blood work, it doesn't even show up. But they know they have some of the symptoms. They run cold all the time. Their hands, fingers, toes, tip of the nose, buttocks, feet in bed are always cold. They're the type of person that always needs a sweater wherever they go. While no one else in the room is wearing a sweater, they have to wear a sweater. They're tired. They can't lose weight when they try. And they don't show up in the blood work to get a proper diagnosis of hypothyroidism. But they know something's off. So decades go by, they just suffer. And that's a good person for me because my natural thyroid support, which you're seeing in the picture here, does really well with those patients. But it also does well with patients that want to supplement the medication that they're already on, because this is safe to take with Synthroid or some of the other pharmaceutical medications as an adjunct, as a supplement, as a fill in the gap for what's missing to piggyback on what they're already doing. And I'll say this again at the end, but in case you don't go that far, you would start, if you're on medication, you would start with one of my capsules per day for at least a week. And you have permission to go up to 2 capsules per day if you want to get a little more out of it. A lot of people just stay on 1 capsule if they're on medication, but some people after a week will go up to 2 capsules. And you would take it 1 in the morning, and if you're going to take the second capsule, you would probably take 1 at dinner or 1 at lunch. I like it with food. You don't have to take it with food because it's made from food. But a lot of people find it is more digestible if you take it with food. Now, if you're not on medication, and again, I'm jumping the gun, but only because I feel a lot of people just scroll or look, and I want to give you the information up front. If you're not taking a medication, but you suspect you would get benefit for more energy, hair, skin, and nail, wanting more out of your hair, skin, and nails, wanting more out of your sexual libido, your mental acuity, feeling cold all the time, wanting that little push of energy that you don't get anymore, this would be a great product for you. And I'd want you to go up to 2 capsules per day if you can handle it pretty soon. So you would start with 1 capsule per day at breakfast. And after 5 days, 7 days, you're already up to 2 capsules per day, because the average adult dose for this is 2 capsules per day. But let's jump in. I want to really teach you a lot about this stuff. And so what percentage of the population has thyroid problems? And the answer is more than 12% of the US population will develop a thyroid condition during their lifetime. And that's a lot, because an estimated 20 million Americans have some form of thyroid disease. And up to 60% of those with thyroid disease, here's the thing, they're unaware of their condition. So 60% of the 20 million don't even know what's going on with their body. They haven't really been able to get a clear-cut diagnosis and treatment plan. The thyroid gland produces hormones that regulate the body's metabolic rate, controlling, listen to this, it controls heart, muscles, digestive function, brain development, and even bone maintenance. You know, how strong and how durable our bones are. It will affect osteoporosis. Its correct function depends on a good supply of iodine from the diet. Now, most Americans get iodine with just a dash of salt, or if you live near the sea, you're going to get it through, or have access to fish, you're going to get some in your fish. But I put a little bit of a kelp-based iodine in my product because it works well, and it's a great maintenance product for people because we don't always get what we need every single day. At least that's true for me. I don't know if it's true for you. So let's go to the next slide. And at what age do thyroid problems start? Well, this disease is hereditary and may develop at an age in men or women, but it's much more common in women ages 20 to 30. And according to the Department of Health and Human Services, it is more prevalent in women and also in the more advanced decades of life. So it could start when you're 20 to 30 years old, but we're seeing it more at 40 or 50 or 60 years old is when people finally get in touch with the symptoms they're feeling is connected to thyroid. The thyroid gland is a gland that makes and stores hormones that regulate the heart rate. Again, we're showing all the different vastness of what thyroid affects in the human body. It affects your heart rate, your blood pressure, your body temperature, at the rate at which food is converted into energy. So when you're not converting food into energy, what do you think it's making? It's getting you fat. And so when this is sluggish, this system in the body that the thyroid pushes, if that's sluggish, it's going to be almost impossible to lose that weight that you are trying to lose. And I'm not saying that people go on my product and lose weight like crazy. No, that's not true. I wish it was true. It would be amazing. It doesn't improve your golf game, doesn't make you run the mile faster, doesn't improve your ability in a lot of different areas of your life that you wish you did. But it gives you the foundational support that when you apply healthy lifestyle, good nutrition, and a sensible weight loss plan, you'll finally feel like you have a fair chance to meet your goals. And I say that because a lot of times women will compare their weight loss to their male counterparts if they're in a relationship with a guy. And so let's say, for example, a husband and wife go on a diet together and the guy loses 10 pounds in the first 2 weeks and the woman loses 0.5 pounds, not even a full pound. And that's frustrating. So it's not an even playing field. But if you're in your 40s, 50s, 60s, or 70s, and you feel like you just need a little bit of support to get on track, this natural thyroid support can stack well with your medication or as a standalone product. So it's worth giving it a try because it's natural, it doesn't cause any harm, it's safe, effective, and we do get great results. And that's why I keep using it year after year with my clients. Not only that, but my own family members. My mother took it for years. So it's really something I would give to my own mother. The thyroid gland sits here. A lot of people feel it's shaped like a butterfly, and it has a left side, a right side in the middle. The middle is called the isthmus, like the connector between two bodies of land in your geography class. That's that part right there. Let's see. There's another picture. I just wanted to show another angle of it. And then coming down to the next slide, some of the signs and symptoms may include, and these are ones, you don't have to have every single one of them, but you might feel that like, oh my gosh, I can connect to a few of these symptoms, like fatigue, increased sensitivity to cold. So you're the type of person that's cold all the time. Bowel is sluggish, constipation, dry skin, weight gain. Your face feels puffy. So people that go on my product or medication as well, not just, or some category of support, will feel like their face is not as puffy and bloated. Their hoarseness of the throat can be related to thyroid, but not always, but it could be muscle weakness, elevated blood cholesterol levels. So people that have a tendency to have high blood cholesterol, muscle aches, tenderness, and stiffness, you can see it, thinning hair, slow heart rate, depression, anxiety, impaired memory, and sometimes in extreme cases you'll get that goiter, that big sac of a thyroid here, but we don't see that too often, at least in this North America. I don't know where you're from, but North America we don't see that very often. So how can people boost their thyroid metabolism? Well, you can take your thyroid hormone. So if you're on medication, please take it. Follow the directions of your medical doctor. You can increase your thyroid metabolism by increasing your exercise, specifically cardiovascular exercise, or mixing up some type of resistance training with cardiovascular. I like things like yoga, Pilates, swimming, weightlifting, if appropriate for you. Avoid skipping meals and starvation diets. Not only is that just a bad idea, but it does not support your thyroid. If anything, it makes your thyroid underperform eventually. You need to get adequate protein, either plant-based or animal-based, whatever's your preference. Right now I'm on a whole food plant-based diet and I'm getting plenty of protein. I used to eat mega amounts of animal protein. I've tried all different types of diets. And I feel quite satiated with the amount of protein that I'm getting on a whole food plant-based diet. So there's a lot of ways to go. I'm not going to say you should do it my way or your way. Who cares? Just do it well. Whatever you pick, do it well. Stay hydrated. Being dehydrated does not help the thyroid. You can always work with your doctor and get enough sleep. So let's move on. A lot of people don't know what Hashimoto's disease is, so I took this straight from the Mayo Clinic, which is one of the preeminent medical facilities here in the United States, as well as research. So I really like their information, and I just grabbed this right off the site. But Hashimoto's disease is a condition in which your immune system attacks your own thyroid. And we know the thyroid's a small gland. I just showed you a picture of it, right near your Adam's apple, or if you're a woman, you don't have a prominent Adam's apple. But the thyroid gland is part of your endocrine system, which produces hormones that coordinate many of your body functions. So Hashimoto's is an autoimmune version of low thyroid. And let's go on. So what's the difference between a Hashimoto's low thyroid and a regular low thyroid? That's a good question, right? Hypothyroidism is your regular low thyroid, is a problem with your thyroid gland, while Hashimoto's is a problem with your immune system. And your immune system is going wacky, causing an autoimmune response where your own immune cells are attacking your own thyroid. So in Hashimoto's, as in all autoimmune diseases, the immune system gets confused and mistakenly attacks part of your own body. In this case, it's the thyroid. And it's the meta-equivalent that says here in this thing, metabolic equivalent, of friendly fire. And that's a reference to being in war, and the good guys are firing on their own good guys by accident. That's friendly fire. So they're saying that that's what happens often in autoimmune diseases. Your own good cells are attacking your own good tissue of your body, glands, or organs. Can thyroid problems make you feel crazy? Because people say, I feel crazy all the time, and is that related to my thyroid? And if you have an underactive thyroid, you may feel stressed and overwhelmed and experience depression, tearfulness, crying a lot, and loss of appetite. So yes, it can make you feel crazy, trust me. Can thyroid problems cause dementia-like symptoms? Well, when hypothyroid has been long and severe, so you've had it for decades, dementia can develop. There are correlations between the two. So whenever possible, either support your thyroid through medication, no problem with that, do it, get what needs to be done. Do not ignore a thyroid problem for decades. It can hurt many areas of your body, and we don't want it to hurt the brain. Now, it says on the last sentence, however, dementia is not the only side pediatric symptom of low thyroid. It can cause anxiety, depression, all sorts of ways that we don't feel good in our brain function, brain chemistry, and mood. What's wild about thyroid hormone is that it really directly or indirectly touches on every cell in your body. So it affects hormones, it affects digestion, it affects circulation system, your brain. It is just touches everything. What emotional problems does hypothyroid or low thyroid cause? It can definitely affect your mood. I mean, that's one of the biggies, primarily causing either anxiety or depression. So people that support their thyroid even a little bit, or even just with my natural thyroid support, or they go on thyroid medication, see a little bit more stabilization almost within the first month or two on their mood or their anxiety. They're feeling grounded, feeling themselves, and feeling less nervous. Can thyroid affect the eyes? Yes, eye problems known as thyroid eye disease or Graves or ophthalm, I can't even say it right now, but affects around 1 in 3 people with an overactive thyroid. And that could be a version called Graves' disease, which I'm not going to get into in this video because I'm trying to stay focused. But problems can include, here's the symptoms: eyes feeling gritty, dry, and definitely sensitive to light. Now, does everybody get that? No, but you might say, hey, I get that. Maybe I should look at my thyroid. Can your thyroid grow back after it's being removed? So let's say you had one of those butterfly wings surgically removed. Can they grow back? And though having the capacity to grow in response to stimulus through the pituitary thyroid axis, the gland is considered not a regenerative organ. So if yours grows back, you are probably a medical miracle. Don't expect it. I'm sure there's going to be someone that could present in the world that said that they were the 1 in a million case where it did grow back, and I don't doubt it because the human body is fascinating. But no, it's not a regenerative organ. You will not see it grow back. Probably, I've never seen one in my lifetime, so if it does happen, it'll be curious to see that medically, but don't expect it. Does iodine improve thyroid function? And I get a lot of questions about iodine. I do have kelp, which is a great source of iodine, and my natural thyroid support because it works. Iodine is an element that is needed for the production of thyroid hormone. So we need iodine to make the thyroid hormone that your thyroid's so desperately trying to make. The body does not make iodine, so it's essential to have it in your diet. We don't just manufacture it out of nothing. We need to be ingesting foods that provide the molecules that our body can then transform into iodine and partner with the production of thyroid hormone. That was a mouthful. I hope you got that one. If you did not have enough iodine in your body, you cannot make enough thyroid hormone. So like I said, yes, in the United States, many people get enough, but just think about it. If you're not making enough thyroid hormone, if you do have low thyroid, can't hurt to get some of these foods in your diet. And if you can't get these foods, if you're not munching on seaweed every day, which I certainly am not, that's not appealing to me personally, then, you know, a supplement can really round out the rough edges. What happens if underactive thyroid is untreated? And I spoke a little bit about this just before, you know, that we shouldn't ignore low thyroid disease or low thyroid symptoms or scenarios. So if you have an untreated underactive thyroid, your risk of developing cardiovascular disease is increased. So that's bad because the number 1 killer in the United States is cardiovascular disease. So why do we want to invite that into our lives? If you have a low thyroid or suspect you have low thyroid, support it and not go down the road that you don't have to, or don't encourage cardiovascular disease to proliferate in your body. This is because having low levels of the hormone thyroxine can lead to an increased level of cholesterol in your body. So it's going to increase that fatty absorption, the plaque, the hardening of the arteries, and thyroid properly maintained will deter that from happening in your body. Can thyroid affect memory? So these are big questions that are always asked to me either in my clinic or through Facebook or through my Instagram or YouTube. And so I'm just hitting on some of the big ones, and we should all be aware of these because cognitive symptoms of people with hypothyroidism include memory problems and the ability to concentrate. So it affects concentration. Research has shown that verbal memory, coming up with that word in particular may be affected by low thyroid. Another study found decreased the hippocampal volume in adults when treated with untreated low thyroid. So it's affecting the brain, it's affecting memory. That's what you need to know about this. Can you lose weight with an underactive thyroid? And I mentioned this earlier in the same video, and it makes it almost impossible. How much weight can I expect to lose once the hypothyroidism is treated? So that's a good question. So once you're treating it either pharmaceutically or the natural thyroid support or piggybacking or stacking them both together, since much of the weight gain in hypothyroid is accumulation in salt and water, when the hypothyroidism treated, one can expect a small, usually a 10% body of weight loss just from water weight in the beginning. So that's kind of nice. And then, like I said, you have to add lifestyle. You have to add good food choices. You have to get on a diet that works for you. And you do have to work on having a proper caloric daily total that works with your metabolism. And that kind of stinks for some people because they might say, hey, when I was in my 20s, I used to, I used to be able to eat so much volume of food and now I can't. Well, I'm in my 50s. I totally understand. I cannot eat what I did in my 20s. So we have to make adjustments. We have to work out hard. We have to apply ourselves 7 days a week to something, to moving our body, eating the right foods, and supporting our thyroid if it needs support. Does your thyroid get worse over time? Symptoms of low thyroid usually appear slowly over several months or years, and even decades. However, some people develop symptoms quickly over a few months, and those are the cases that go from 0 to 60 miles an hour fast. We see that sometimes. People say, I was perfectly fine through my 30s, my 40s, and then all of a sudden, within like a year or 6 months, my thyroid crashed. That happens. A lot of times that happens because of the trigger of menopause, and that abrupt change in your estrogen and progesterone levels is shocking to the body, shocking to the thyroid, and one theory is that might be a component of the sudden hypothyroidism swing. So yeah, in general, the lower your thyroid hormone levels become and the longer they stay low and untreated, the more severe your symptoms will be. I put L-tyrosine in my thyroid product, which is an amino, and a low level of thyroxine, which is one of your thyroid hormones. You have T3, T4, and high thyroid stimulating hormone, which is your TSH, indicate an underactive thyroid. So when your T4 goes low and your TSH goes high, you have an underactive thyroid. That comes up in your blood work. You don't have to memorize that. Supplementing with L-tyrosine may lead to a reduction in the TSH, so it lowers the one that went high. And this reduction is because the tyrosine is a building block for thyroid hormones. So L-tyrosine is a good idea to have in my natural product. I put it in there because it works. And I'm just letting you know about this stuff because I put a lot of thought into the ingredients of my custom thyroid product. There are a lot of good ones out there. Try whichever one you want. It doesn't hurt my feelings, really. It doesn't. I just try to make the best one I could for my patients and my family. Like I said, my mother has been on it for years. Another great product for thyroid is the ashwagandha herb, and it has been used for centuries in alternative medicine. So it's been around forever. But finally, research gets done on it, and it's very supportive for low thyroid. And as you're going to see in the next slide, when someone asks me if they have Hashimoto's, the autoimmune low thyroid, should they take ashwagandha or take my product? The answer is no. It probably won't be a good idea. I mean, if you feel like working closely with your doctor and experimenting, by all means, but without supervision, I would not take my natural thyroid support if you have autoimmune low thyroid, because it's going to mess up your levels and usually is not a good idea. Having said that, if you have hyperthyroidism, which is excessive thyroid, it's accelerated thyroid, don't take my product either, okay? Because it's not a good fit. My product is a good fit for the big bracket, which is hypothyroidism, regular low thyroid. Some of the foods that improve thyroid function: roasted seaweed, such as kelp, nori, wakame, are naturally rich in iodine and also other trace elements in the seaweed that is great for thyroid function. Salted nuts like Brazilian nuts, macadamia nuts, and hazelnuts are also shown to be excellent sources of selenium, and selenium is also supportive to the thyroid function. Baked fish, frozen yogurt, fresh eggs are all things that come up when we do Google searches on this subject. What supplements can help hypothyroidism? Well, we want to see a little bit of iodine, not a lot, but a little bit, the right amount, and that helps you make thyroid hormone. Vitamin D is important for thyroid function. Selenium, zinc, tyrosine, like I said, specifically the L-tyrosine. And I have all these in my ingredients on the back of my bottle of the thyroid. You can see that I carry or formulated the product with that. If you want to ever try my product, it's at my website for where I keep all of my products, littletreenutritionals.com. You'll also find it in these links below, of course. And like I said, people want to start with 1 to 2 capsules per day. If you're on medication, like a thyroid medication, start with 1 capsule per day. Stay at 1 capsule per day, like with breakfast, for example, for a week. Then you can go up to 2 capsules per day if you feel you need it. If you want that little extra bit of boost, then go to 2. If you don't like being on 2, go back down to 1. You can play with it. If you're not on thyroid medication, but you suspect that you need more energy, help with weight loss program, hair, skin, nails, fatigue, depression, anxiety, memory, mental acuity, mood swings, sleep, libido, my product would be worth trying for sure, because I've given it to so many people over the years that it makes a big difference, and I'm excited for you to try. You would want to get up to 2 capsules per day as soon as possible. You would start with 1 for a few days. If it doesn't make you feel like you have too much energy or giving you too much energy that you can't get to sleep at night, then please go up to 2 per day, because the average adult dose is 2. I hope this helps as just a beginning crash course. I hope to do more of these. Let me know in the comments below if this is helpful. And, if you're interested at all, give it a try. Thanks.